ours is palpation. So our first one is to palpate C7. So with their neck exposed, you want to find the most like prominent area of the spinous process. You want to palpate that spinous process and the one above. And then you want them to flex their head down. So can you bend your neck forward, please? Perfect. And then all the way back up and now back. And if you're on the right one, C6 will disappear and C7 will stay. Okay, next. All right, I'll feel on your side. All right, so to palpate for the greater trochanter, you want to find the top of the iliac crest, and then about 4 to 5 inches down will be the greater trochanter, and there's like a little dip right above it, and that's how you'll know that you're on the head of the greater trochanter. Okay, head of the femur, greater trochanter. And then I'll need to back up. And then, so to palpate for the bicipital groove, roll up your sleeve and then find the humerus. And then you'll find the greater and lesser tubercles. And right in between is the bicipital groove, and you can confirm by putting your finger on the greater tubercle. And if you move their arm into like internal external rotation, you'll feel your fingers slip into the bicipital groove.
All right, so next one is ASIS. So you can do this on yourself initially. So you can just place your hands around your hips, feel your front fingers, and you can kind of move slightly medially and superior. And you'll feel that you have your hip bones sticking out. You can also have this if I'm gonna have the patient. So Jess, I'm gonna have you turn, face them. So I'm just gonna come in front. So I would just come around here with kind of a cylindrical grip, place my hands around her hips here. I'm just gonna slightly move medially, superior, and I can feel her ASIS here. All right, next one is PSIS. So there's a couple ways to go about it. So again, you can have them in standing or prone depending on their preference. If they're not able to tolerate prone, obviously have them stand. For this person, we'll have her stand. So you can come here around cylindrical grip, iliac crest, come in, that's L4, count down L5, S1, S2, go slightly lateral. You should feel some bony prominences sticking out. You can confirm by having the patient lift up one leg or the other for marching. So Jessica, can I have you lift your leg? Yep. And I can feel those PSIs as one dropping down below the other. And then medial joint of the knee, again, come to the patella, feel on either side with your thumbs. You can kind of drop into that sulcus. You can confirm by having the patient extend their leg and that gap should close. Good, and then go ahead and have that open, and your thumb should sink right back down into that sulcus.
This slide is just for your review for the anatomy for the ankle. And we'll post the slides with our YouTube video.
So we're going to be going over the 3 lateral ligaments. So the anterior talofibular ligament. You're going to find the lateral malleolus and come to the anterior part of it and slide roughly 1 inch distally towards the head of the talus, and you're just going to palpate in there. It might not feel like you're strumming over anything because it's pretty difficult to palpate. The next one is the calcaneofibular ligament. So you're going to come to the distal end, and then of the lateral malleolus, you're going to find the calcaneal tubercle, and then run at an oblique angle from there, and that should run that direction, and then you can strum over it that way. And then the last one is the posterior talofibular ligament. You're going to come to the distal side of the lateral malleolus and slide just off of it distally to find that ligament that connects to the talus there. Again, that one you're not really going to feel, but the ankle palpations are good when you have a patient that comes in with a lateral ankle sprain to feel for tenderness of what ankle would be or what ligament would be injured. And then I don't know if you guys want to say yours or you want me to.
For the medial joint line of the knee, that would be a good one for total knee, so you can measure edema. That's one of the landmarks for measuring that.
Mm-hmm. And then you can also do ASIS and PSIS if the patient is having any pelvic tilt and if they're having difficulty, especially in the hips and the SIJ.
That's it.